There are moments in life when health appears stable and predictable, yet hidden inside ordinary routines. Subtle risks accumulate quietly and create conditions that can suddenly lead to devastating medical events. One of the most common examples is stroke, a condition that does not arrive by pure chance, but often develops slowly through the repetition of small daily habits, particularly during the first hours after waking. As a physician with years of experience in neurology and internal medicine, I have witnessed countless patients who appeared healthy, independent, and strong, only to lose speech, mobility, or memory because of avoidable morning practices. The truth is that stroke is not random. It is the result of modifiable risk factors that interact with aging, circulation, and lifestyle, and understanding these connections provides an opportunity to prevent life-changing consequences. In this presentation, we will examine 7 common morning habits, moving from the least harmful to the most dangerous, while explaining the physiological mechanisms involved and the practical steps anyone can take to reduce risk. The goal is not to create fear, but to provide clarity and awareness, because the earlier you identify harmful patterns, the sooner you can replace them with healthier alternatives that protect the brain. Let us begin with the 7th habit, drinking excessive coffee on an empty stomach, a practice that may seem harmless, but carries important consequences for blood pressure and cerebral circulation. Caffeine stimulates the release of adrenaline, increases heart rate, and narrows blood vessels, producing a sudden rise in blood pressure that can reduce blood flow to the brain, particularly in older adults. A study published in 2011 showed that the risk of ischemic stroke doubles during the first hour after drinking coffee, especially when consumed before food because caffeine is absorbed more rapidly. For individuals with hypertension or irregular heart rhythms, this surge can be enough to trigger a transient ischemic attack, also known as a mini stroke, or to destabilize existing cardiovascular conditions. The recommended approach is simple. Begin the day with water, eat a light breakfast first, then consume coffee in moderation, ideally limiting intake to 1 moderate cup and avoiding excessive sugar or cream. The 6th habit involves ignoring morning dizziness, weakness, or unusual sensations, symptoms that many people dismiss as signs of aging or poor sleep, yet in reality, these can be neurological warning signals. Dizziness can indicate insufficient oxygen delivery to the brain, while sudden weakness, facial asymmetry, or speech disturbance, even if mild, may reflect a transient ischemic attack, which is a serious predictor of future stroke. Medical associations encourage the use of the FAST acronym, face, arms, speech, time, as a simple method to recognize potential early stroke signs and to emphasize the urgency of immediate medical evaluation. If you notice any unusual weakness, imbalance, or speech difficulty upon waking, do not wait to see if the symptoms disappear. Instead, record what you feel, contact your physician, and treat every episode seriously. Another important behavior to consider is the speed with which you leave your bed, because suddenly standing after sleep can produce orthostatic hypotension, a rapid drop in blood pressure that reduces cerebral perfusion. During sleep, circulation slows and blood pressure decreases, and when you rise abruptly, the body may not compensate quickly enough, leading to dizziness, fainting, or in high-risk individuals, a trigger for stroke. The safer approach is to remain in bed for 1 or 2 minutes, perform slow breathing, sit up gradually, and then stand, allowing time for blood pressure and circulation to stabilize. Before continuing, I want to pause briefly to invite you to support this channel, because if you find value in this type of medical information, subscribing and activating the notification bell gives strength to this work, and liking the video helps us reach more people who need these insights. Your engagement is what makes it possible to continue sharing scientifically accurate advice designed to protect health. So if you appreciate this effort, consider taking that simple step to support the channel. Now let us continue with the 4th habit, holding urine too long after waking, a practice that places unnecessary stress on the cardiovascular system, particularly in adults with hypertension or vascular disease. A full bladder stimulates the release of stress hormones such as cortisol and adrenaline, which elevate blood pressure and constrict blood vessels, effects that can reduce cerebral blood flow and increase stroke risk. One study published in 2000 showed that bladder distension can significantly restrict coronary and cerebral circulation, especially in individuals with existing arterial stiffness or atherosclerosis. The solution is immediate and practical. Respond to your body's signals. Use the bathroom promptly after waking, and avoid delaying this basic physiological need in order to check your phone or remain in bed. The third habit is neglecting hydration, which is one of the simplest yet most important protective measures for the brain, because after 7 or 8 hours without fluids, the body enters a dehydrated state. Dehydration thickens the blood, increases viscosity, elevates blood pressure, and forces the heart to work harder, which reduces efficiency of circulation and directly impairs oxygen delivery to brain tissue. A study from 2015 found that stroke patients who were dehydrated were nearly 4 times more likely to experience poor outcomes compared to those who were adequately hydrated. To counter this, start each morning with a large glass of water at room temperature before coffee or tea, and especially if you take diuretic medications that increase fluid loss during the night. The second most dangerous habit is consuming a breakfast high in salt. A common issue since many processed foods contain hidden sodium levels far above recommended amounts, particularly cereals, bread, and packaged meals. Excess sodium increases blood pressure, stiffens arteries, and damages delicate cerebral vessels, significantly raising stroke risk, especially in the morning when blood pressure naturally spikes after waking. Research in 2012 showed that individuals consuming more than 4,000 milligrams of sodium daily had over 2.5 times higher risk of stroke compared to those consuming less than 1,500 milligrams. Healthier alternatives include fresh fruit, oatmeal without added salt, boiled eggs, or whole grain bread, and the target for sodium at breakfast should ideally remain under 400 milligrams. Finally, the most critical habit is skipping or misusing prescribed morning medications, particularly for blood pressure, atrial fibrillation, or cholesterol management, errors that directly increase stroke risk during the most vulnerable hours of the day. When patients forget or delay doses or attempt to double them later, they disrupt the protective rhythm of treatment, leaving the body unshielded at precisely the time when blood pressure is naturally elevated. Even simple mistakes, such as swallowing pills without water or with coffee, can reduce absorption and render essential medications less effective, creating a false impression of adherence while risk accumulates silently. The best strategy is to build a consistent system using pill organizers, phone alarms, or support from caregivers, and never adjusting doses without direct medical guidance, because medication timing is a critical element of stroke prevention. What emerges from these 7 habits is a clear conclusion. Stroke does not simply appear suddenly without cause. It develops through gradual accumulation of risk factors, many of which are hidden inside ordinary routines. The positive message is that by identifying and correcting these behaviors, you can dramatically reduce your vulnerability, and small, consistent changes often produce significant long-term protection for your brain and overall health. Consider each morning as an opportunity to either increase or decrease risk, and remember that prevention is not about complex interventions, but about simple, consistent choices repeated daily over time. Your brain is responsible for your identity, your memory, your independence, and your relationships, and protecting it through small, disciplined steps each morning is one of the most important investments you can make. As you reflect on these 7 habits, ask yourself which of them are present in your life and commit to replacing them with healthier alternatives, not tomorrow, but starting with your very next morning. If this information has been useful, share it with others, because awareness is the most effective form of prevention, and together we can reduce the impact of stroke across families and communities. Your health is not determined by luck, it is determined by daily decisions. And now you have the knowledge to make choices that strengthen your brain and safeguard your future. I encourage you to return for the next video, where we will continue exploring practical strategies supported by science designed to help you maintain health, independence, and quality of life for years to come.